Don't really know what I'm going to be doing with this video. I don't know if anyone will ever get to see it. But I just wanted to make some record of the reason why I am as I am now, and that my long-standing mental health problems have deteriorated, and I'm not sure that there is any other way out for me. I do hold the medical professionals who have recently been involved in my care, using that word very loosely, for causing a profound amount of trauma by misguided, trying to be charitable here, misguided decisions, and basing those decisions primarily on a need to protect their careers, a need to tick boxes, cover backs, and not take into consideration that what they decided was appropriate action for me, in my case the serving of a Section 135 warrant under the Mental Health Act 1983, which involved being accosted outside of my home by 8 total strangers, 5 of whom were uniformed police officers. 2 I subsequently found out were consultant psychiatrists who I'd never seen before. They didn't even know each other. Somebody whose title was an approved mental health professional. And there are also 2 locksmiths present. I can only assume that that was to put right any damage caused should the police decide that it was necessary to break the door down to gain access to my house. I can't really think of any reason, any justifiable reason why it would be deemed necessary to send 5 uniformed police officers to attend such an incident. I was and never have been a danger to anybody else. I have full mental capacity. I am able to make my own decisions about whether I accept any medical treatment for my long-standing eating disorder and my other complex mental health problems. And because I've now been denied the right to retain autonomy and to decline any further involvement with mental health services, I have been subjected to further abuse, psychological abuse, which has completely and utterly traumatized me. And I feel that this is the point of no return now. And I want this video to serve as a message to all who view it, that just because there is a set of guidelines put in place when an individual has a diagnostic label attached to them, that once that label is there, then boxes A, B, C, and D all have to be ticked, regardless of what the specific needs of that individual might be. They cease to become a person. They just become a diagnosis on legs. And boxes get ticked. Professional backs get covered. Patients get harmed. So please, please, look at the Mental Health Act. Look at who it's really serving to help. And make changes so these terrible things never happen to other people. Because there will be other people like me who have been harmed and who can't come back from that harm. And before I go, I just want to thank the few friends that I do have who've stood by me for years, regardless of how I am, that I'm different, that I don't fit into any boxes. Those people are Pauline Phillips, her husband Nigel, my ex-partner Malcolm, my friend Michelle, who used to live next door, and my vet at first, and now subsequently became a very dear friend who has helped enormously with regards to not only being a friend to me, but also looking after my family, who I regard as my family anyway, my pets, and always making me feel that I am capable of making decisions, of just being an ordinary person. I don't like to use the word normal. Those few people, they treat me as if I'm a person. I'm not a diagnosis on legs. I'm not Jane the anorexic. I'm Jane the human. I always have been. So thank you to those people. You have always, always made a difference. To the medical professionals, I'm not going to name you. There's no point. But you know who you are. Please, please, think what making decisions based on NHS guidelines, on box ticking, on backs covering. Think what that could do to the person you are caring for. And again, I use that word caring very loosely. Because one size doesn't fit all. Sometimes the boxes can't be ticked. Sometimes you have to take a chance that doing things differently might be a risk, but it could be a risk really worth taking. Because it could be that one thing that makes it possible for the person who has gone to you for help to actually make progress, to to actually be able to have a life that is manageable. And I will just end that here, because there really isn't anything else to say.